The webinar is being recorded.
Thank you for joining our TMLT webinar. Today, we are going to discuss 10 tips for reopening your practice with COVID-19. The presentation today will be presented by myself, Cassie Turner, and Kathy Bryant. I am a Senior Risk Manager in the Risk Management Department at TMLT. And Kathy, would you like to introduce yourself quickly?
And I am Kathy Bryant. I'm the manager of TMLT Product Development and Consulting Services.
Before we begin, we would just like to provide this disclaimer to you all that this is not to be referred to as our primary legal source. These are just resources that we're providing to you as education. We'd also just like to note that with COVID-19, we know that it's a fluid and rapidly evolving situation, and there could be some changes after this webinar has been recorded. So please keep that in mind. So as we get started, the first thing that we'd like to note is on May 1st, 2020, the Texas Medical Board rule was put forth, and this rule puts forth some minimum standards for safe practices that are required by each practice. All physicians providing patient care or engaging in an in-person patient encounter must implement these standards. The first one is that a mask must be worn by both the patient and the physician unless they're within less than 6 feet between the patient and the physician. We must also follow policies of the physician, medical, and healthcare practice for the facility or whatever is in place for COVID-19 screening and testing and or screening patients. And Kathy will discuss this in a little bit more detail later in the presentation. Before any encounter with a patient, they must be screened for potential symptoms of COVID or verified previously screened within the last 20 days. And that prior to having any surgical procedure in the mucous membrane area or anything around the respiratory tract with a high aerosol transmission, that minimum safety equipment be used by the physician and or delegates, such as the N95 mask or equivalent. And all physicians providing patient care or engaging in person patient encounters and other hospitals as defined by this code of Chapter 241 of the Texas Health and Safety Code must meet these minimum standards. And we've linked for you the TMB FAQ website there, and we've also put a downloadable file of this on the left-hand side of your screen that you can download. So here's a posting that is required as well for you to put into your office. It just highlights those rules that we just covered briefly, showing what is expected as far as minimum standards of safe practice. So the first thing, as you're getting back into your practice, taking into account the rule put forth by the TMB, is to review your infection control plan. We've put some tips here for you that the CDC recommends as you are planning to reopen. Visitors should be, patients should be wearing masks. Also, keeping in mind children under the age of 2 or anyone who is having trouble breathing, unconscious, incapacitated, or otherwise unable to remove the mask without assistance should not be placed on, those masks should not be placed on them. Patients may remove their mask if they are in their exam room, but should put them back on when they're leaving their room or when others enter into the room. And again, screening for symptoms and appropriate triage, evaluation, and isolation of individuals who report symptoms should still occur. And here we have the resources for you that cover those basic guidelines for infection control from the CDC.
Our second tip is for you to review how you're going to maintain social distancing in your office. Some people are actually changing this term up a bit and are talking more about physical distancing, which makes a whole lot more sense because that is really what we're asking people to do. So take a minute, look around your waiting room, your front office, your exam rooms. How are you going to maintain that 6 feet distance between patients? In the waiting room, if your waiting room typically looks like the picture on the upper right-hand side, clearly physical distancing is not possible. Is it possible to either move some chairs out of the waiting room, or in some situations, we've heard of practices that are having patients wait in their cars and they're called when it's time for them to actually come in and be escorted directly to an exam room. And of course, just keep in mind that the CDC does have recommendations on face coverings, as well as local orders may be coming into play as well.
So third thing is, can check-in be paperless? So thinking ahead and how you can minimize interaction with your patients, how to maintain the social distancing or the physical distancing, as Kathy mentioned, during registration and check-in. Can you make use of your portal or email or fax to collect documents before the patient arrives? Patient can send those via email or through the portal and have their insurance cards updated or copies of their ID or any patient forms that you're asking them to complete before coming into their appointment.
Tip number 4 is you need to screen your patients and visitors for symptoms of acute respiratory illness. Obviously, when patients call for appointments, you're going to be screening them. But if they bring someone in with them, do you have a process that you're going to be actually screening the visitors as well? Or even other types of visitors, perhaps pharmaceutical reps or others coming into your office. Even maintenance staff for repairs that you may need to be done. So think about when you're going to be doing this screening, who's going to be doing it, where will it be documented, and what protocol do you have in place for staff to follow if a patient has positive symptoms? And lastly, how are you going to segregate these patients to keep them away from your well patients that are in the clinic, perhaps just for a wellness visit? Would just remind you that this is part of the Texas Medical Board rule that before any encounter, patients must be screened for potential symptoms of COVID-19 or verify that they've been screened within the last 20 days. So obviously, if you saw a patient this week and you're seeing them back in a week or 10 days, you would just have to have a way that your staff could verify that. And that's why your documentation will be important. Both the Texas Medical Board and the CDC have provided some resources on screening for COVID-19. So you might want to take a look at these. We have both provided these as downloads in the downloadable file on the left-hand side.
Tip number 5, providing PPE for you and your staff. As we mentioned at the outset, that there is a requirement that physicians or delegates are required to wear protective masks. So just looking at your staff, what are your needs for PPE? Where can you get them? How can you obtain them for your staff? And then also training your staff on proper use of PPE. And we have a couple of questions here from the TMB with regards to PPE. One is, are doctor offices responsible for providing masks and gloves to patients who come to their office, and what type of mask is required? Currently, the rule does not require gloves. However, offices may set their own policy and make mask and glove requirements. From a risk management perspective, we would recommend that you have a written policy, ideally. Again, on this. However, if a patient does not have a mask, the practice must provide a mask or some type of face covering, especially to protect other patients. There are no requirements specifically to the type of mask that the patient must wear, but a mask must be provided or a face covering must be provided to the patient. Another question, are physicians allowed to refuse treatment to a patient who is not wearing a mask? Yes, the decision to see any patient is at the discretion of the physician practice. And also, how would I treat and or examine a patient if they are required to wear a mask? The patient does not have to be wearing a mask if it is needed to be removed during the course of the examination or during treatment for a procedure. However, the physician should be wearing a mask and appropriate PPE. If there's a high risk for aerosol transmission, physicians should wear appropriate PPE as stated in the CDC guidelines. Here you'll see the Texas Medical Association has some information about personal protective equipment distribution. If you are looking to obtain, you can check there. TMLT has also been offering KN95 masks to policyholders. Currently, there is a waiting list for that, but you can go on hub.tmlt.org and get additional information from TMLT and or TMA if you're trying to obtain PPE.
So another tip is think about how much cleaning and disinfecting you're going to be needing to do. Obviously, you've always had processes where you cleaned exam rooms, cleaned waiting rooms. Obviously, exam rooms would be after each patient. Waiting rooms might have been just done on a single everyday basis. We would recommend that you have a written process. What are you going to be using to clean and disinfect? For instance, we've heard that a lot of practices are having trouble getting their usual cleaning products, especially if they used the pre-made wipes. Those may not be available. So, of course, the CDC has been recommending a bleach dilution that can be used. Also, you're going to want to enforce hand hygiene, frequent hand washing, and use of hand sanitizer. We would recommend you document your training or retraining on the processes that you do for your staff, and consider documenting not only the process you're going to use, but if you are going to clean your waiting room every 2 hours, for instance, have some way that you document that you actually have done that. Again, don't set yourself up for a process you can't actually complete.
So tip number 7, provide staff training before reopening the office. Training on the new processes as far as social distancing or physical distancing is concerned. Again, use of PPE. Also taking time to reassure your staff of protection for them as well, and allowing them time to ask questions and just have a better understanding and hopefully feel a little bit more comfortable as they re-enter into the clinic, into the practice.
Elective procedures. We've had lots of questions come in about elective procedures. They relate both initially to Governor Abbott's orders, the TMB rules, and now we're even getting questions about requirements that facilities are placing on practices. The biggest question, though, that we seem to be getting was actually addressed in the TMB frequently asked questions about scheduling office-based visits and procedures. And you can certainly do that as long as you're maintaining your safe practices requirement set forth in the rule that we've already discussed.
So tip number 9 is continuing telemedicine after reopening the office. Currently, the pandemic rules apply until revoked from Texas and federal law. And again, if you're thinking about continuing to use telemedicine, there could be some rules that would change as the pandemic rules are revoked. So you want to keep an eye out for any rules that would be changing once we are through this pandemic and those laws have changed for telemedicine in particular.
Tip number 10 is you want to review your new processes with patients prior to their arrival at the office. You want to consider posting updates on your website, perhaps reviewing the process at the time of reminder calls, or emailing patients with your new process. You may have a patient portal even that you can push this out through. We would advise you to be cautious if you're using mass emails. You do not want to include everyone in the to line. If you are going to do an email to multiple patients, be sure and put their email addresses in the blind carbon copy section of the email address section. There are lots of good resources out there on COVID-19, coronavirus, and we've just listed a few here for you from TMLT's Resource Hub, TMA, their coronavirus page. The AMA has a lot of good resources as well, and those links are active. Additionally, we wanted just to point out that both the Texas Department of State Health Services and the Texas Medical Association have resources about testing. I would imagine as practices open, you're going to be getting a lot of questions about where can I go to be tested or should I be tested, those types of things. These resources will be valuable to you. Last but not least, last week, the U.S. Health and Human Services Office for Civil Rights sent out an emergency cyber threat notice that cyber criminals are taking advantage of the current COVID-19 global pandemic for their own financial resources and resource gains and malicious motives. There are a lot of resources out there. Some of these are not new. The first one, the Cyber Attack Quick Response Checklist, has actually been available for a couple of years. This is simply you need to have a plan just in case something happens. The COVID-19 email phishing against U.S. healthcare providers is an FBI notice regarding email phishing attempts targeting healthcare providers. Typically, COVID-19 or something similar is in the subject line. There have been reports of online extortion scams, and those have been increasing during the COVID-19 crisis. The Internet Crime Complaint Center released an advisory regarding the increase in online extortion scams. A couple more cyber-related resources. Selecting and safely using collaboration services for telework. The COVID-19 VTC exploitation, that's video conferencing. I think we saw some examples in the news about Zoom meetings being hacked. This is just another advisory on that. The COVID-19 cyber threats is just an overview of COVID-19 related cyber threats. And I would encourage you to take a look at these. The ones that are applicable are a great example of ongoing security awareness training that's required required by the HIPAA security rule. So if you document having shared some of those resources with staff, you can check off that box for this month at least. At TMLT, we're committed to helping you and your practice get through this pandemic crisis. Please reach out to us if you have questions. You can visit our website at tmlt.org, our resource hub at hub.tmlt.org, or calling our risk management department. Currently, we have extended hours that we are taking phone calls from 8 a.m. to 8 p.m. Monday through Friday. We hope that you found this information helpful today, and if you have questions, please feel free to reach out to TMLT.